Headlines each week. School shootings. This is a video from Parkland. That was in Florida. There's been some in Michigan, even in our backyard at a Birmingham high school. Now, a new push is underway in some areas of the country. So mental health advocates are pushing schools to screen every student for mental health issues. Joining us now to break this down is the owner of Silver Linings Neurodevelopment, Dr. Megan Crisler. Thank you so much for being with us.
Thank you.
This is an important topic, and I'm not sure it's going to go away anytime soon. Do you think it is important to test every single child?
Perhaps not test. Testing can often be an hours-long process.
Okay.
Screening might be a nice place to start. Currently, right now, we already screen for vision, we screen for hearing, we screen for a lot of different issues, and mental health would be a perfect next step to fit in with that. It would be short, it would be quick, and it would be feasible to do a simple 5-minute screening.
Okay. Why do you feel like early detection? Do we start this in elementary school? Should we start it in middle school? Where do you?
I think that's where the discussion needs to expand, because it depends on what we're looking for. So one of my specialties is within autism, and so with that, you start seeing signs at 18 months. Okay. Anxiety, depression, you can see signs of that as early as 4 years of age. So it starts early.
Okay, so maybe in elementary school, get started. Early detection, why is it so important? Why do you think it's so important to figure out these issues early on?
So when kids are really young and they start to show these issues, there are a lot of interventions we can do in regards to introducing coping skills. By the time you reach adulthood, a lot of these behaviors have become more ingrained, and they're harder to address.
Now, as far as parents and teachers, what signs do they need to look for if they think a child might have some issues later down the road? What are some early signs they can look for?
Pretty much any change in behavior, and we're talking about sleep, we're talking